So today I am going to explain you that is vomiting. Vomiting is also known as emesis. Okay, this is the definition of vomiting. Vomiting is a forceful expulsion of the gastric contents through the mouth and sometimes nose. So what happens? Vomiting sometimes comes out through the nose and it usually comes out through the mouth. Okay, and these are the causes of vomiting. Let's discuss one by one. First is gastritis. Gastritis is the inflammation of the gastric lining. Second is brain tumors. Brain tumors increase the intracranial pressure, which further lead to vomiting. Third is motion sickness. Motion sickness is a disease which is caused by the motion during travel. Fourth is poison. Any kind of poison like toxics or like cyanide poisoning or lead poisoning. These are some example of poisoning which leads to vomiting again. Fifth is medication. Any kind of medication like chemo drugs or other drugs also lead to vomiting. Sixth is brain injuries. Brain injuries also lead to vomiting. Okay. Seventh is gallbladder disease like cholecystitis. Okay, cholecystitis. Think about cholecystitis. Cholecystitis also lead to vomiting. Early stage of pregnancy. In the early stage of pregnancy, beta acidity level increases, so that lead to vomiting again. Reaction to certain smells or odor. Some sort of smells, bad smells or odor also lead to vomiting. Okay, and acidosis. Okay, acidosis also lead to vomiting. Management of vomiting. First is we are going to give antiemetic drugs to manage the condition that is vomiting or emesis. Second is advice to take plenty of fluids to reduce dehydration. What happens when a patient excessively vomit? Okay, he may have the problem that is dehydration. So in that case, we are going to give a lot of fluid so that we can manage the condition of dehydration. Oral rehydration salts also given. We can give ORS or oral rehydration solution to manage the dehydration condition. Okay, let me explain you one more thing here. Vomiting. Um, if vomiting has a bile, that is bilious vomiting. If vomiting doesn't have a bile, that is non-bilious vomiting. If vomiting has a bile, it means that there is some sort of blockage in the intestine. Okay, if there is no bile present in the vomiting, it means that it is just a result of regurgitation. This was all about vomiting. You can take a screenshot if you want to take. Okay, so it was enough. Let's meet you in another lecture.